Where there is a need for physical interaction, only 4 officials from any given MDA will appear before the committee, and where it is not necessary, the queries and responses will be made online. On the plenary side, since there is also pending business, the plenary sittings have been moved from parliamentary chamber to the conference hall to also curb the easy spread of the virus. Extra measures of spaced seating, extra points with sanitizers, proper cleaning of lifts, and the other furniture has been affected. The Speaker in the plenary yesterday announced that Parliament has downsized the number of staff working during this period. This follows the earlier directives to have all interns, personal assistants, forum staff ceasing to access the premises of the Parliament. The downsizing of staff is aimed at discongesting the Parliament premises to ensure that the safety of MPs and staff, while at the same time ensuring that parliamentary business continues smoothly. The heads of department shall, on their rotational basis, determine which officers are required to report to work. It should be noted that those members of staff are not on leave. Those members of staff are not on leave and may be called on at any time. Some staff will be facilitated to work from home, and the measures instituted for that will be strictly followed. It should be noted that Parliament takes serious measures that have been instituted to curb the spread of the virus and urges public to adhere to them. We remind the public to follow these to the latter. Wash your hands with soap and water. Use hand sanitizers if you can afford them. Avoid crowded spaces. Cover your nose, your mouth with disposable tissues. And flex your elbow when you are coughing or sneezing. Ladies and gentlemen, we also emphasize stay home and self-isolate from others in the household if you feel unwell. Do not touch your eyes, nose, mouth if your hands are not clean. True, some of our friends were in Dubai, and yesterday the Speaker mentioned their names. Even members went ahead and mentioned some of them who are in South Africa. And when they gave us that assignment, we went ahead and called the chair of National Task Force and the Ministry of Health to move to their homes. First of all, if they are at home, be checked and check the whole families, the family members, but also quarantine them. And on the same question, if one member as someone said, that he saw very many in Dubai. I don't know whether in transit or they were together with him. One, he should help us and give us the list, because members travel on official and unofficial duty. Sometimes a member can travel on his own, and he doesn't need, I think, to notify the commission. So if he could help us and give us the names of those ones he met in Dubai, then we would inform the relevant authorities to deal with the matter. About the prices, I think the president was very clear yesterday, those who watched, and today I have seen in Koboko, they have arrested one business person who had increased the prices, and I think the government has started acting, working on those ones that are hiking the prices.
Members of parliament cannot run away from certain obligations. It is like in times of war. You can bring people to camps and say you people go to camps, but the soldiers, the medical workers, the Red Cross will definitely be working. So in such a pandemic, government needs resources. The budget must run. The Ministry of Health will need money. The security forces will need money. So if we don't complete this budget process, then it means at some stage the country will be stuck and we cannot move. And so people must understand why certain obligations cannot be done away with, and we must continue as an institution to finalize these processes so that even after this financial year, because we don't know how long this situation is going to take, so the country must run, and for it to run, certain obligations cannot be run away from.
This task force is being chaired by the Prime Minister. We had a meeting yesterday comprising of all the UN bodies in the country. We had all the ministers. We had some few development partners, for example, Uganda Red Cross, some corporate bodies, and then some ministers, line ministers, who are concerned about this. What I would want to say, the President, the Minister of Health, the private not-for-profit hospitals, the doctors, or any other medical staff are not the front line, but you are. The virus does not spread, but we spread it ourselves. There is no medical solution as yet. You are the solution. What I can only tell Ugandans is the COVID-19 is real. It is here in the country. Let's wash our hands as much as we can with soap. Let's do social distance and stay at home. We are going to have a redesigned dissemination of information, and it's going to be translated in each local language. And we are going also to have the call centers regionalized. So when you're calling, like in Karamoja, there will be a free call center in Karamoja. In West Nile, it's not going to be institutionalized like the call centers that we are having right now, which we have already got a complaint from the general public that they're not going through just because they're over-congested. Yeah. So they're going by the close of business today. We shall be able to communicate probably when these lines will be available at regional levels so that people can be able to call and get information.
Members of Parliament receive information from their voters and from the public, and therefore there's need for this information to be able to reach the national decision-making body. And therefore, so far, as the Honorable Nyakun said, we have attended one meeting chaired by the Prime Minister in which key decisions have been made, and a roadmap is being drawn on how the country will be responding to this pandemic. And therefore, we will be updating Parliament through the Right Honorable Speaker on some of the key decisions that have been made from the National Task Force, and at the same time also picking that information or information from here and feeding it to the National Task Force. And therefore, to me, that is a very important network or coordination so that nobody is left out. And in this process, we need each and every person to be well coordinated in terms of sharing information. So I appeal to the public to use their members of parliament to forward whatever information that needs to be forwarded. Like for this morning, actually last evening, we received information from a concerned citizen that there was an individual who was in downtown operating normally, and yet he had just returned from Dubai, and the person gave us the phone contact. And as I talk now, that person has been picked, and samples have been taken away off from this individual, and hopefully it will turn negative. So this coordination is very important for us and the public. I thank you.
The budget process has timelines beyond which we cannot process the budget. And some of these activities have due dates which cannot be missed. For example, like he said, the policy statement come on the 15th of March every financial year, and those trigger the beginning of the process. On the 1st of April every financial year, that is when the Minister of Finance actually tables the actual budget estimates. And according to the guidelines yesterday in the House by the Right Honourable Speaker, this is going to happen on Tuesday, 31st, and that's the last day beyond which the budget estimates for the next financial year cannot be read. Therefore, that means that Parliament, at least if it is to end, at least the budget statement must have been presented and laid in the House. Again, after that, like in the main press statement, the budget process usually takes 2.5 years, 2.5 months, from 15th March, when the press statement comes, up to 31st May. However, Parliament took cognizance of the crisis, and we have shortened this period to 2 weeks. We have already issued the guidelines. Among the guidelines, as already noted, the usual interaction between the sector committees and the MDAs, where they come to defend their budget, has been shortened and deferred to online interaction. The budget committee is going to sit and scrutinize the entire budget process, because all the chairpersons of the sector committees belong to the budget committee. So some of the processes as contained in the rules of procedure have been adjusted to fit within the 2 weeks that the Parliamentary Commission guided us to process the budget. Usually, this process goes on up to 31st May, but we expect that once the budget is tabled on Tuesday, 31st March, which is the last day, to 1st April, we need 10 days within which to process the budget. And unlike the previous legislation, the Public Finance Management Act indicates that the budget is approved before we begin the next financial year. So 31st May must be the last day, but we are not going to reach that far. Again, one important thing to note, that the budget has both the revenue and expenditure side. So the budget is usually first stated by the finance bills, or what you call the tax bills. According to the Public Finance Management Act, when they lay the budget on Tuesday, it comes with the appropriation bill and the finance bills. These are the tax proposals, the new changes in the tax regimes that is going to help URA to collect the revenue that is going to finance the budget. So all of these cannot be waved away because the country will come to a standstill. That's why we expect that when the finance bill together with the budget estimates are laid, Parliament will work expeditiously to complete the process within the prescribed time, so that the country doesn't get to halt. So basically, that is the main reason why we are still working, and as other measures have been taken, Parliament has downsized, but only the staff that are very critical to handling this process have remained working. According to the Constitution, Article 156, 2, the President is allowed to authorize expenditure if there is an emergency and the money is spent, and he brings that approval 4 months after the expenditure. So I don't think the Minister of Health has complained that they don't have money to run the crisis. Already, government should have authorized expenditures beyond what Parliament approved in the last financial year. So because the law allows the President to authorize expenditure, to withdraw money from the consolidated fund, to allow for expenditure on emergencies, and to bring the spent money 4 months after expenditure. This crisis has just started in Uganda, and I think it is well handled. We have 2 schedules that have already been presented to Parliament. We haven't processed them. Actually, one of the second schedule was presented last Thursday, and it's yet to be processed. And that also, as the Honorable Commissioner said, we cannot just close Parliament. But the laws that govern the supplemental are very clear. If the expenditure must not exceed 3% of the approved budget according to the Public Finance and Management Act. So there should be no worries about Parliament not passing expenditure. The expenditures have to come from the executive. So, and if the executive is headed by the President who has not brought it to Parliament, Parliament is not allowed, according to Article 93, to authorize an expenditure without being provided from the executive.